Hi, everybody. Thank you for joining me for this week's Community Spotlight. And with me today is a very good friend of mine, Cathy Billings. Cathy is coming to us representing the Oklahoma Department of Mental Health and Substance Abuse. She's actually the director of the facility in Norman, and we're going to talk about a little bit about that. But I just really wanted to stress that this is a great resource for folks who may be having some challenges. And so wanted to state that right up front that, this is a very unique time that we're in. And that's why we felt it was very important to highlight this resource and make it available to folks who could benefit from this information. So Cathy, thank you so much for joining us today. You and I have been friends for a really long time, and we won't bore everybody with those details, but can you tell everybody a little bit about you and what you do?
Okay. I am the executive director here at Central Oklahoma Community Mental Health Center. We actually were the very first community mental health center built in the United States. When President Kennedy signed the Mental Health Act, that freed up federal funds to be able to put mental health centers in communities across the nation, and ours was the very first one. I'm so proud to say that. And we opened in 68, and so 68, 69, and so we've been here 50 years. I haven't been here the whole time, but we've been open for 50 years, and our buildings were really kind of cutting edge, and they won architectural awards for this open concept we had for community mental health and skylights and just something that looked welcoming to people coming in for services. So I've been here, it'll be 5 years in June. I came to this job from a mental health center where I was working in Virginia, and Oklahoma's home for me. So it was really nice to come back and be around my friends and family and do the work that I love so much. So yeah, Oklahoma's a great place. I've been away a couple of times, but I keep coming back.
I've got to tell you, it is a pretty great place, and we are always glad to see you when you come back. When you leave, we are so sad. So, Cathy and I worked together, I don't know, I don't even want to add up the years ago, but have a shared passion for taking care of people and finding ways to serve our community. So we connected that way, and that connection has lasted through a couple of moves and a couple of jobs. And I think you have found a good fit for you. And I know that the work that you're doing there has been just incredible. And it's just such a privilege to watch that. Talk about how your team has really innovated and challenged how you provide customer service with all of the unique challenges of COVID-19.
So our center is all outpatient, where we have services from little kids all the way up to seniors. So we see the continuum of, human people from little age to older. And we provide therapy, case management, parenting classes for the parents of our kids that are in treatment. We also provide substance use disorder treatment. We have a Suboxone clinic where we treat opioid addiction. We all know that's been has really ravaged our state. And so we have been operating a Suboxone or medication-assisted treatment clinic for about 4 years now. And so it's just the kind of services where we wrap the services a person may need around them. Our treatment teams meet them where they are. And we feel like when somebody is on the road to recovery, we're a partner and walking that path with them. It's very consumer-led and consumer-centered, where people, we help them to reach their recovery. And recovery is real, it's powerful. And I feel always, talk about how much I love my job. And people, sometimes they say, "Oh, what do you do?" And I say, "I work at a community mental health center." And they go, "Oh," I'm like, no, don't be sad. I love my work. We have therapists, case managers, peer staff, psychiatrists, and nurses. And so we provide services to help people become whole. And it's all outpatient, but we do have a mobile crisis team. So if someone is in the community having a crisis, they can call us and get directly connected to a licensed therapist where we can help them figure out what's the next step. What level of care do they need? Is outpatient work, or we try to arrange for them to get inpatient, get a bed in a hospital? And so our staff, in changing or adapting the way we provide services during COVID, the pandemic, is that most of our services were all in offices. We have a specialized program called PACT that is out in the community, and that's for people who are not, they like the traditional, I sit across from my therapist and talk to me in an office. These folks need a higher level of care. So the therapist and the doctor and the nurse and case managers go to their home. So our PAC team has been out in the community. They've modified their work too. But we went from in-office, face-to-face services to telemed services in about 10 days. We stood up a complete telemedicine system to keep people home and safe, and also to keep our staff safe, because we really didn't want to contribute to the community spread or people get sick. And so I have been so proud of our staff. It's like we had to shift schedules and do some technology training because, this is all new. We haven't had these kind of tools at our disposal before because we really didn't need them. And so now we Zoom everything, we meet and, staff cases and everything. But like every other organization in the state, we have followed CDC guidelines and also from the Oklahoma State Department of Health for screening and mask and PPE. We still screen everyone that comes into our campus. Their temperature is taken and answer some tests, some questions, and we give them masks if they would like that. We encourage it for everybody to wear a mask, and just really try to keep things going. And we have really seen that our number of canceled or no-show appointments have gone down because our therapists are able to do Zoom or telephone calls. And I guess there's something about being in your safe space that people really like that. And a lot of our consumers, the people we service, said, I don't want to ever go back to that. Let's always do it like this. And so, there's been some really kind of unintended positive things that have come from this. And so, but I will say it's been challenging for us because we've all been in our offices. You have people up and down the hall all the time. And now we have different schedules, so we don't have so many people in the buildings at the same time. So I think for our staff, it's been challenging. They miss their peers and, the camaraderie that comes from working with other people. But I'm glad to say that we have really done a good job on, taking care of people and people staying well. So
that's something to be very proud of. And I know you are, and you talk a lot about how great a team you have. And I think a lot of times we forget essential workers, medical professionals, first responders, and you kind of are all three. They have their own feelings, their own families, their own concerns, their own health issues. And so it can be really challenging to navigate that, especially when you work with the public and such a group of folks that, really do need your help, and you feel that additional stressor. How are you and your team working to take care of yourselves?
We have spent quite a bit of time, the supervisors, talking with their staff. One team has a phone tree they do where, there's a dedicated person I call and check in, see how you're doing, and really trying to make sure we practice good self-care because we can't take care of our consumers if we're not well. And so everybody, a lot of us have pets, so we, share dog videos and things like that, and really just touching base with each other on the days that there are people here. We may bring lunch in, or your foundation brought us hot dogs and chips and drinks one day, and that was lovely. It just made us feel so appreciated, and it was just a nice thing. So thank you again for that when you guys did that for us. So
Such a small thing for us to do with all the things that you're doing. So glad that it helped.
yeah.
Talk to me about some of the services. We've talked about the therapy and telemedicine and some of those things, but tell me a little bit about 211 and how you're connected.
211 is a statewide number. You can call that number and be connected to resources. Maybe not just mental health or substance use, where you're like, I need to find daycare for my child, or I need to find a doctor. 211 is it's just I guess catch-all for lots of questions people have. And so if you know someone or there's someone in your family that's having an emergency around mental health care, you can dial 211 and they can connect you to someone that can help. Also, if you go to odmhsas.org, that's the Oklahoma Department of Mental Health and Substance Abuse Services, it's got a treatment locator, and you can click your part of the state wherever you are and be connected to a service provider. The Oklahoma State Department of Mental Health, which is our agency that we are a part of, has contracts or state-operated facilities all across the state. So anywhere in the state you live in, any of the 77 counties, you can access outpatient or inpatient care if you need it. And so we work with a lot with the Norman Public Schools. We have some of our therapists that are embedded there to help the counselors there with kids and things like that. We do just counseling. We do therapy, case management, because sometimes if you're having a mental health crisis, everything has kind of tumbled on you. So you may need help with housing. You may need us to help get you set up with the food pantry, or your kids are having issues and you need them in counseling and services as well. So we really try, or educational goals, or getting a job. So all of those things, because like your mental health isn't just your mental health, it's your whole being. It's, it's whole health. And so if one part of that is off, it affects everything else. I really, still, even in, 2020, there's still a lot of stigma around people that need mental health or substance use disorder treatment. And so we work every day to kind of bust those myths about that. It's like, if I had diabetes or I had a heart condition, my friends would be like, go to your doctor, get taken care of, And so, but sometimes when people say, I'm really not feeling myself, I'm kind of depressed, things haven't felt right, sometimes the answer is this, oh, just go get some rest, you'll be fine. Or, go get your hair done or something. And so I want us to look at when people have a mental health emergency or a crisis, that we say that's part of healthcare. It's like if you had a broken arm, you'd go to the emergency room. And so if you are having issues in your life and where things aren't right and you need to see somebody, we're here and we want to help. We also help with medication. So if it's someone that doesn't have any kind of health coverage, we help them access their medications. And we are, even if someone doesn't have insurance, you can come here. If you have insurance, you can come here as well. But we really are a service for people who don't have any other services, any other insurance, and we are glad when people choose us to be their provider of choice. It's an honor and a privilege to provide services to people because they are trusting us with their lives. And so we take it very seriously that we want to do as best from them as we can. We have a Facebook page if you want to check us out. It's COCMHC. Is that right? Yeah. Central Oklahoma Community Mental Health Center on Facebook. And we post new things every day about things that are happening in our world now, tips around good mental health and physical care. So please check us out, like us on Facebook. I sound like a commercial, but we have a really active Facebook. So
you do, and I do look at it a lot. So thank you for that. And I think with May being Mental Health Awareness Month, for me, this was a timely discussion, and then you add all of the challenges with the pandemic. And do you foresee, just your gut, I know you don't really have any metrics at this point, but do you think we're going to see, maybe it's twofold, maybe there's there's a spike in people who need services because people are quieting down long enough to maybe they need to make some changes, or they feel a certain way and want to address those concerns. I know that for me, it's the first time in probably 20 years I've sat still for longer than a hot minute. And so I've really done a lot of processing and thought-provoking things. Where do I want to go from here? So I'm sure if I'm doing it more than me is. But do you also think that may also help remove some of that barrier to seeking mental health wellness and to really battle that stigma as more people address it and kind of confront it?
Mm-hmm.
Could that be a positive?
I think so. We've gotten much more calls asking just for information. And is this, these are happening. And we're like, come and see us. And I think something that has been so, not just the U.S., but across this world, what's happening with people being ill, and that more people are home, because they aren't working. And it's like you said, you kind of slow down and life slows down, and then you're kind of left going, I really need to talk to somebody. I really am, I'm facing things that I've kind of been able to put off a little bit. And so it is very, very normal, I think. And if you look at the research and everything that's coming out from SAMHSA and other places, they talk about that the next epidemic will be the mental health needs of this country, of people who have gotten through this and they need some care. And so we really have been doing some strategic planning around, we want to be ready to respond when this happens. And so that's why we've stood up these mobile crisis teams that we can deploy. And we work very closely with the Norman Police Department and the Sheriff's Office to call us if they're at a scene and they think somebody needs help. They can talk to us immediately, and we can talk it out or send someone out to help them staff it, or help get them to a bed if they need to get to a hospital, or to outpatient if they need that. Because I saw a video the other day that was really positive about reaching out for help. And it was like all these stars, I think it was like, and they were like, do it, now's the time, ask for help. And now with so much telemedicine, we can do so much more and reach, people at all times. They can call us, and if they need us, we have a 24-hour phone line that's answered all the time, 24/7. And there's a licensed therapist that answers that phone, and she can help direct. That's 360-5100 if anybody needs that, and it's answered all the time. Because sometimes you wake up at 2 a.m. and you just need somebody to talk to, and we want to be there, pardon me, because we're all in this together. And I really have been proud of Oklahoma and how we have really rallied around each other and done this work. We have so many community partners in Norman and across the state that we can look to for resources, or, somebody calls us and they actually live further away. And I'm like, look, I can find you somebody like 20 minutes from where you live. We're much further away. So we refer to, our sister agencies across the state. And I think that's what's so great about the Department of Mental Health, is that our network of providers is so rich and so many different types of services that, people are able to access care in the ways that meet their needs and helps them, to get back to their normal, to get back to where they want to be. And I always say recovery is real and it's powerful. I say that a lot because I really believe it. Because there's treatment, there are therapists, counselors, doctors, medications, and we help people find that right mix of what it is that it takes for them to feel better and, to move along. We also have mental health court and drug court, and I'm sure we don't have enough time to talk about that, but if you've ever been to a graduation from someone that's been through mental health court or drug court, I dare you not to tear up because it is amazing. You know, you hear
I won't pass.
somebody will get up before the judge and they will say, I have 600 days of sobriety. And I'm getting chill bumps just saying it. Or like somebody said, I have 30 days of sobriety. I have 10 days of sobriety. And it's amazing, you know, what that for them, and to have these people cheering them on and wrapping them up in, you know, in positivity and belief that they can do this and continue to do it, you know. So, yeah.
I think we found your hidden paycheck, right? Right? Am I right? Yeah. It's those moments that keep you going, and we're so glad that you have those and that you're doing the hard work that you do. And it's tough to lead a team of folks that care so much, and that can be draining as well. So doing an amazing job always. I'm not surprised, but want you to know you're appreciated.
Yeah, thank you so much. We had a dad of a little boy. I think he came when he was 5 or 6 and had a lot of issues. And our therapists and case managers start working with the dad and the little boy. And he came back to talk to us at a staffing we had and said the little boy had gotten an award for his grades and he was doing so well. And the dad said, I learned all these new parenting skills and I don't have to hold him all the time when he gets so angry. And so what he said has stuck with me. He said, to look at you guys' buildings from the outside, you know, kind of nondescript, not modern at all. He said, you wouldn't know it, but inside those walls, miracles happen. And I think about that all the time, that miracles happen. Yeah.
That's pretty cool. A great testimony to the work you guys do. And
unsolicited. He wrote a op-ed in the newspaper about it. Didn't even tell us. It was pretty cool. And I just think about that. Yeah, you know, because when I say, where do you work? I said, at the mental health center on Alameda. And they were like, oh, that old building on Alameda. I'm like, it's been there a while, yes. And I'm like, don't let the outside fool you. It's some
that's where miracles happen.
It does.
That's a pretty good tagline there, Cathy.
Yeah, where miracles happen.
So because this is Mental Health Awareness Month, as we close up this interview, what would you encourage folks to do if they know someone who needs help, or what would be the first step that they should take?
I would suggest that they encourage that person, support that person to make that call, to even sit with them when they make that first call to a treatment facility, whether it's us or somewhere, Ada or McAllister, wherever it is, and support them through that. Treatment can be, if you don't have a real strong support system, can be lonely. The therapists do an amazing job, but when you have a support system that's there with that safety net to catch you as you're going through that, it makes all the difference in the world. So I would say encourage them, help them make the call, dial a number, just really encourage them, because that's the hardest step. Usually it's just that first phone call. And if we can get you into the office or get somebody on the phone with you, you know, from there, it's just like you're connected to a treatment team. They're wrapping services around you and figuring out how we can help you, how we can help you on the journey that you've predetermined for yourself. How can we help you? So I say just the call is the hardest part, but call us, or and you know, if you go to odmhsas.org, you can click the button for a treatment locator and find one in your area, or you can call 211. So you can access somebody all the time, and that being in treatment is life-changing, whether you have mental health issues or substance use disorder. Reaching out for us is just like reaching out to your primary care doctor. If you have heart problems, or your blood pressure is wonky, and if you think about it like that, it's an easier call to make, that you're calling for your brain health, and it's just as important as heart health or whatever. And so I think when you think about it like that if you're diabetic, you're going to go to the doctor and get your diabetes under control. And if you have problems with brain health, we're here. Like, we're the ones to help you with that.
And I think that everything starts in your brain, right?
Absolutely.
If that's not right, it's going to be hard to keep the rest of you healthy.
Right. Yeah. And
so thank you again for all of your work and for taking a few minutes and sharing it with the rest of us, and just continue to do all the good work that you do. And please consider us a resource and an advocate for that work. And for everybody else, we thank you for watching this, and hopefully it was helpful. And we look forward to seeing you next time on our Community Spotlight.